increases, which is of course not a favorable outcome. So also here there's some balance between, well, we see on the short term that the HbA1c improves, but on the other hand we see, or we know that there's something happening with this LDL cholesterol, which means that we are a bit cautious in recommending people to follow a very low carbohydrate diet. And that is also the reason that we, if you look into the recommendations for both fat intake and carbohydrate intake, we say that the evidence is inconclusive for an ideal amount of total fat, and the same actually holds for carbohydrates. So there's actually no evidence to say how much carbohydrates or how much fat people should eat when they have type 2 diabetes. And you also see that the goals should be individualized. And this means that we recommend actually dietitians or healthcare professionals to make an individual treatment plan also in respect to their dietary intake of patients. So coming back to this list with dietary patterns that we recommend for people with diabetes, we also have two other dietary patterns, which are the Mediterranean and vegan or vegetarian diets. And these are two diets that do not really focus on macronutrients, but more on the content of like the food groups that are included in these diets. So here we go back to the results for Mediterranean diets and the risk of type 2 diabetes. So this is not really the treatment, but related to diabetes risk. And here they compared both randomized controlled trials and cohort studies. And you see here again the summarizing the summarized result of all these studies, and you see that the risk of getting type 2 diabetes is lower for people who adhere to a Mediterranean diet compared to people who do not adhere to a Mediterranean diet. And this is actually a different way of showing the effects of Mediterranean diets in studies. So here, this is a meta-analysis that focuses on treatment of type 2 diabetes. They compare different intervention studies on different outcomes. So for example, HbA1c, but also LDL cholesterol, triglycerides, weight measures, for example. And they did some analysis on how to, they wanted to find out for which factor the Mediterranean diet was the most effective. So they listed different dietary patterns and they compared all these outcomes in different studies to see, for which outcome, which diet would be most beneficial. You see that the Mediterranean diet is, the most highly ranked, so the best option, for example, for HbA1c, but also for cholesterol levels and also for weight measures. And this is quite interesting because if we compare to another study that actually did the same, so they also compared different intervention studies for people with type 2 diabetes and also ranked different dietary patterns, they come to a different conclusion. So here you see that for HbA1c, the low-carb diet is more favorable and the Mediterranean diet is just second. And for LDL cholesterol, it's even the fourth option. And only for the cholesterol measure, so the lipids, the Mediterranean diet is the best option. And I think one of the reasons that these two studies show different results is that also here there's no consensus on what actually is a Mediterranean diet. So there's a problem of definition here. How can you define a Mediterranean diet? Do you look into what people really consumed, or do you ask people how many times do you consume things that you think are in a Mediterranean diet? And there's also something happening here with selection bias, because although both studies used randomized controlled trials in people with type 2 diabetes, they used different studies to come to the conclusions. And of course, there's also again the problem of adherence. So although people may fall under the category of following a Mediterranean diet, it's always the question if they really also adhered to these Mediterranean diets, or that they were just put in this group and then just didn't follow the guidelines that they were given. So if we take a closer look into what is actually a Mediterranean diet, I think we can be sure that a Mediterranean diet is rich in fiber, also in unsaturated fatty acids, and that there are lots of fruits and vegetables, but there are also some things that, well, I think differ between studies or differ between researchers how they think about this. For example, the use of red wine. In some studies they advise people to drink a glass of red wine because this belongs to the traditional Mediterranean diet, whereas in other studies they recommend people to do not consume any alcohol at all. So this is also already a difference in the different studies that were analyzed in the meta-analysis. And the same holds actually for caloric restriction. So in some RCTs they recommend people to also lower their energy intake, whereas in others they did not. I think also this is an important thing to consider, that, well, when people are included in a dietary intervention, that there's this role of caloric restriction playing an important role, whereas it's unclear in certain studies if people were instructed to lose weight or not. And then there's the plant-based diet. So this is relates more to the vegetarian and vegan diets. And for this, I have this this Dr. Barnard, and he. I think it's nice to show you this video because he will tell you how to reverse your diabetes in 3 steps. And I'm just curious what you think about the way he describes the diet, and also the way he convince you that you should do what he thinks is best for you.
Many people are concerned about the risk of diabetes, and many people have it already. If you have type 2 diabetes, though, it can be a two-way street. And to begin a diet change to reverse diabetes, step 1 is to avoid animal products. Now, you might be thinking, wait a minute, I thought I was supposed to avoid sugar or avoid bread or maybe rice. Well, these carbohydrates do release glucose into the blood, and that's why people thought, okay, that sugar must be the problem. But it turns out that the real problem with diabetes is the buildup of fat inside the cells of the body. When fat builds up in your muscle cells or in your liver cells, the sugar can't get inside, and that's the problem. And so that's why step 1 is to avoid animal products, because when we do, there's no animal fat in the diet at all. That helps the cells to clean out. Step 2, keep vegetable oils to a minimum. If you're the kind of person who is making dinner and you take your bottle of oil and you go glug, 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 oil all over everything, that fat gets into your cells too, and that's a problem. So step 3 is choose the healthiest foods. So white bread, okay, but rye bread or pumpernickel, much better. The whole grain breads are better. White potatoes are okay, but a sweet potato is much better. If you're having a breakfast cereal made for children, that's going to raise your blood sugar, especially if the box of cereal has a toy inside. You know what I'm talking about. Have a healthier kind of something like oatmeal porridge or bran cereal. That's better for you. Instead of sugar, have fruit. Apples and bananas and oranges and peaches. These foods taste sweet, but they're very gentle on your blood sugar. So, step 1, get away from the animal products. Step 2, keep the oil very low. Step 3, choose the healthiest sources of carbohydrate.
So I'm going to stop him here. What do you think of his talk? Do you agree with him that people, should follow his 3 steps to reverse their diabetes? Any thoughts on what he says? So when I watched this video and I thought, well, this is some of these kind of influencers who just want to, tell that people should get rid of all the meat in their diets and switch to a plant-based diet. But actually, I started looking for, the studies he did, because he's also a researcher. And I came across this intervention study in which he compared vegan and conventional diets. And he followed people for 74 weeks, so it's a very long trial in which they recommend people to consume or to adhere to one of these diets. And, he also says in the video that you should, do not use a lot of oil, not the glug, 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 olive oil on top of all your meals. So actually what he investigated was not only a vegan diet, but really also a low-fat diet. So the prescribed diet did only contain 10% of energy from fat and 75% of energy intake from carbohydrates, which is really high. As I told you, in the Netherlands we eat about 50% or 47% of our energy intake from carbohydrates. So people were not only asked to avoid animal products, but also to avoid fatty foods and to include foods with a low glycemic index. So those are foods that do not result in a very high glucose peak after you eat it, such as beans and green vegetables. So those are products that contain a lot of dietary fiber. And if we look into the results, well, this shows the HbA1c, and here you see the weeks of the intervention. And indeed, you see that the group that adhered to this vegan, low-fat diet group has a lower HbA1c compared to the conventional diet group. So, well, according to this study, I think it's very convincing. But of course, we do not want to rely on only one study. So if we take a closer look to different studies that were conducted, oh, I'm just going to skip this. Here you see different outcomes, so not only the HbA1c, but also the level of blood lipids and the body weight and blood pressure. And this is again a meta-analysis, so here we compare different studies. And you see that indeed the HbA1c and the fasting glucose favors the vegetarian diets. So this is here not only vegan, but also the vegetarian diets are included. And the same actually holds for the LDL cholesterol. For me, this is not really a surprise, the LDL, because we know that LDL cholesterol is also closely linked to the intake of saturated fatty acids, and this is mainly in animal products. So if you remove the animal products from your diet, you also decrease your intake of saturated fatty acids, and that may be an explanation why we see a lower LDL cholesterol when people start to adhere to a vegetarian diet. But here I think is an interesting one, because we see also that there's a reduction in body weight. And this always made me think that, well, what is actually causing the reduction in HbA1c and in cardiovascular risk factors? Because we also know, and that's also what we saw in the direct trial, for example, that if people lose weight, that also the other risk factors improve. And especially for the vegetarian and vegan diets, we do not really know if it's really what people eat, so if it's really the plant-based products that explain the reduction in HbA1c and in LDL cholesterol, or that it's just that people start to lose weight because they reduce their caloric intake on a vegetarian or vegan diet. So, well, this was actually a point of discussion also in our working group when we were writing the dietary guideline. Should we then recommend everyone with diabetes to start a vegan diet? Well, we had a lot of discussion because, of course, it's for many people a drastic change in their behavior. And there are not so many studies that investigate vegan diets. So there are some studies that take a closer look into the vegetarian diets, but for vegan diets we only found a couple of studies. So this is actually why, well, we thought, well, there are a number of factors in a plant-based diet that are healthy, such as that there are a lot of fibers, and these may also relate to an increased feeling of satiety, which may have favorable effects on body weight, for example. We also know that the intake of fiber reduces the fluctuations in glucose levels, so there are also some glycemic effects for high fiber diets. And as I said, there's also a change in the saturated fatty acid intake, so we know that plant-based products are rich in unsaturated fatty acids, and this might be beneficial for your lipid levels. And you also change, of course, from the animal-based protein towards plant-based protein, and for this we do not really know the effects on diabetes, so this is still a point of discussion. And another thing that is important to consider is that there are always risks of deficiencies when people start to adhere to a vegan diet. So this is why we recommend to help people in changing their diet into a more plant-based diet. And in some cases we also recommend people to supplement the vitamins they miss in their diet. So if we go back to this list,
So sorry, just to understand this a little showed us,
Yeah.
which I thought was very provocative. I think links back to what Mariana was saying in her first class about how different people, different entities, doctors, influencers, all have something to say about diets and nutrition and related to disease, whether or not they necessarily study it as researchers. Where did you think, like, what was your take on that? Would you agree with what that person said?
Well, I don't know, because I don't think adhering to a vegan diet is, well, the best option for everyone. I mean, of course, if someone with diabetes wants to change their diet and they think, well, maybe I should get rid of my animal-based products, I think it's a good option because there are some benefits. But it's not that everyone should adhere to a vegan diet, and I also don't agree that that is the only way to, well, reverse your diabetes.
And do you think it really is about vegan diet, or is it just about reducing your overall caloric intake while increasing your sources of fiber,
Yeah,
a lot of which comes from plants anyway?
That's the question, yeah.
Do we know yet?
We don't know, but, well, my personal view is that I think it's indeed the change that people make, and we see in every vegan trial that people reduce their caloric intake and that they lose body weight. So that might be an explanation why also the HbA1c, for example, improves. Yeah.